Wartenberg Syndrome, superficial radial nerve entrapment. Wartenberg Syndrome, also known as superficial radial nerve entrapment, is a condition characterized by compression or irritation of the superficial branch of the radial nerve. It causes sensory disturbances, such as pain, tingling, or numbness along the radial thumb side of the wrist and hand. This condition is different from Wartenberg's sign, which is associated with ulnar nerve dysfunction. Anatomy involved. The superficial radial nerve is a sensory nerve that supplies sensation to the dorsal, back side of the thumb, index, middle finger, and part of the hand. It travels superficially along the forearm, just under the skin, and becomes more vulnerable to compression as it crosses the distal forearm near the radial styloid. Etiology causes. Wartenberg syndrome can result from various causes that lead to nerve irritation or compression. Common causes include 1. Direct compression, wearing tight wristbands, watches, or handcuffs that compress the nerve. Trauma to the wrist area, such as from a fall or direct blow. 2. Repetitive motion, repetitive forearm pronation, turning the palm downward, and supination, turning the palm upward, can irritate the nerve, especially in activities like using a screwdriver, typing, or texting. 3. Surgical or medical procedures. Surgical interventions around the wrist, such as for de Quervain syndrome or fracture repairs, may lead to superficial radial nerve injury. Needle injections or blood draws that inadvertently affect the nerve. 4. Inflammation. Conditions like tenosynovitis, inflammation of the tendons and their sheaths in nearby areas, can indirectly cause nerve compression. Ganglion cysts or other masses near the radial styloid can compress the nerve. Clinical presentation. Patients with Wartenberg syndrome primarily experience sensory symptoms along the radial aspect of the wrist and hand. The key symptoms include pain, a sharp or burning pain along the radial side of the wrist and hand. The pain may radiate toward the thumb and index finger. Numbness or tingling, sensory disturbances such as numbness, tingling, or paresthesia, pins and needles sensation along the back of the thumb, index, or middle fingers. Hypersensitivity. The skin over the affected area may become overly sensitive to touch or pressure, hyperesthesia or allodynia. Exacerbation with movement. Symptoms may worsen with wrist or forearm movements, particularly pronation and supination, rotational movements. Absence of motor deficits. Since the superficial radial nerve is purely sensory, there is no associated muscle weakness or loss of motor function in the hand or wrist. SHAR diagnosis. Wartenberg syndrome is diagnosed based on the clinical presentation and physical examination. Key diagnostic maneuvers and tests include 1. Tinel's sign. Procedure. The examiner taps lightly over the course of the superficial radial nerve, usually near the radial styloid, thumb side of the wrist. Positive result. Tingling, numbness, or shooting pain radiating along the nerve's distribution, thumb, index, or middle fingers. 2. Finkelstein's test, to rule out de Quervain syndrome. This test may cause some discomfort in Wartenberg syndrome due to nearby structures being irritated, but it generally does not reproduce the patient's specific symptoms of nerve pain. It helps differentiate between de Quervain syndrome, which affects tendons, and Wartenberg syndrome, which affects the nerve. 3. Wrist and forearm maneuvers. Pronation and supination. Symptoms may be worsened by movements that stretch or compress the superficial radial nerve, such as rotating the forearm or flexing the wrist. Sensory testing. Light touch and pinprick tests can reveal areas of reduced or altered sensation along the radial side of the hand and fingers. 4. Ultrasound or MRI, optional. In some cases, ultrasound can help visualize any compression or impingement of the nerve caused by ganglion cysts or other masses. MRI may be useful for ruling out other causes of wrist or hand pain, such as tenosynovitis or tendon issues, but is not routinely required. Differential diagnosis. Wartenberg syndrome can be confused with several other conditions involving the radial side of the wrist. Key conditions to differentiate include de Quervain syndrome involves inflammation of the APL and EPB tendons, causing pain and tenderness on the radial side of the wrist. The Finkelstein test will be positive, and the pain is tendon-related, not nerve-related. Carpal tunnel syndrome, affects the median nerve and causes numbness and tingling in the thumb, index, and middle fingers, but typically not the back of the hand or the dorsal thumb. Phelan's and Tannel's signs are positive over the carpal tunnel. Radial tunnel syndrome. Compression of the posterior interosseous nerve, a motor branch of the radial nerve, which can cause deep aching pain in the forearm and weakness of wrist or finger extension. Treatment. Treatment for Wartenberg syndrome is typically conservative and aimed at reducing compression or irritation of the superficial radial nerve. Options include 1. Rest and activity modification. Avoiding repetitive movements or activities that aggravate symptoms, such as frequent pronation and supination of the forearm, is essential. Avoiding tight objects. Removing or loosening wristbands, watches, or other tight accessories that may compress the nerve. Splinting. A wrist splint may be used to immobilize the wrist and forearm in a neutral position, reducing nerve irritation. Splinting is typically recommended for 2 to 3 weeks to allow symptoms to improve. 3. Anti-inflammatory medications. NSAIDs, e.g. ibuprofen or naproxen, can help reduce inflammation around the nerve and provide pain relief. Topical NSAIDs may also be applied to the affected area for more localized relief. 4. Corticosteroid injections. In some cases, a corticosteroid injection around the nerve may help reduce local inflammation and provide temporary relief of symptoms. This is often used if conservative treatment does not sufficiently alleviate symptoms. 5. Physical therapy. Nerve gliding exercises. These exercises help mobilize the superficial radial nerve and reduce the risk of entrapment or compression. Stretching and strengthening. Physical therapy may include stretching exercises for the wrist and forearm muscles to reduce pressure on the nerve and improve function. 6. Surgical intervention. Rare. Surgery is considered in rare, severe cases where conservative treatments fail and the symptoms are disabling. The goal of surgery is to release the nerve from any structures compressing it, such as scar tissue or ganglion cysts. Prognosis. The prognosis for Wartenberg syndrome is generally favorable, with most patients experiencing significant improvement with conservative treatment. Early intervention is key to preventing chronic symptoms, and the majority of cases resolve with rest, splinting, and activity modification. Prevention. Avoid repetitive wrist movements, limiting repetitive pronation and supination activities, e.g., using tools, typing, helps reduce the risk of superficial radial nerve irritation. Use ergonomic tools, modify the work environment, or use ergonomically designed tools that reduce strain on the forearm and wrist. Avoid tight accessories. Ensure that watches, bracelets, or wristbands are not too tight, as these can contribute to nerve compression.